Well, hello and good evening and welcome. Welcome to this workshop on what is cranial osteopathy. The intention of this workshop is to give you an understanding and education about the various aspects of cranial osteopathy so that you know when it might be appropriate to use for yourself or for your family. Now, it has taken me years of learning and experience to get to this point. And so clearly, I'm not going to cover absolutely everything today. So please don't be disappointed. Plus, as an osteopath, my focus is always totally bespoke and unique patient-centered treatment. Therefore, what I say today is by necessity going to be generalized, as someone else's tailored solution may not be right for you, even if you have similar symptoms or a diagnosis. So welcome to this workshop on cranial osteopathy. My name is Gayle Palmer. I work at the Living Elements Clinic in Chichester in the UK, and I have been qualified since 1991, but actually been practicing cranial osteopathy for a few years before that. And I've always had a special interest in this particular aspect of osteopathy. So let me begin by explaining that, a little bit like the name of osteopathy itself, cranial or craniosacral osteopathy is still a misnomer. Yes, clearly I do work on the head, but I can use this technique anywhere in the body. So I can focus on big tissues, organs, function, structure, energy, fluid dynamics, spirituality. I can work on the energetic body as well as the mental and emotional one. So it is a really extraordinarily powerful technique to be able to use. I'm just as at home treating an area of heart muscle that's dysfunctioning to an organ or a structural muscle or jaw development. So that might give you a bit of a surprise, but there we go. So osteopathy is a philosophy of healthcare, and it acknowledges that the living body is a self-renewing, self-regenerating, self-recuperating system that maintains health constantly throughout the body. Whenever that health-maintaining system is compromised, symptoms or disease can develop. Osteopathy is concerned with that which has compromised health rather than the resulting condition. So as an osteopath, I am looking for the health in the patient, not necessarily so concerned with the symptoms that they're experiencing. And osteopaths have been regulated by statute since 1993, so 2 years after I qualified. They're trained to diagnose conventionally and also to use their hands to assess body function and dysfunction. This gives the osteopath uniquely sensitive information about the disability within the body and how this insight might be used to help restore health. Although people commonly describe their symptoms in terms of conventional medical conditions, osteopaths do not primarily treat medical conditions. They're more concerned with the cascade of events that could have contributed to the development of those medical conditions, i.e., if you treat the cause, the symptoms will then dissipate. So what is cranial? What is cranial osteopathy? This is a specialized area of osteopathy, but it's based on exactly the same guiding principles, plus a few others, as the founder of osteopathy developed, Dr. Andrew Taylor Still, in Missouri in the United States back in the 1880s or so. The cranial osteopathy was further developed by a remarkable osteopath who was trained by Still, Dr. William Garner Sutherland. who was born in Wisconsin in 1873. And aged 25, he became a student of Andrew Taylor Stills and graduated from the American School of Osteopathy in 1900. He began the study of osteopathy in the cranial field when he took apart the bones of a skull and was struck by the resemblance of the bone's articular surfaces, i.e. between the bones, with the gills of a fish. They were reminiscent of both motion and respiration. This led to decades of further study, primarily by years of inquiry with his own clients and personal experimentation on himself, using a variety of rather interesting contraptions, odd-looking helmets which distorted his cranium. And he could tighten the pressures with straps and buckles and what have you, to literally physically warp his head. And hence the function, as a result, that his head was able to perform. He then observed the changes which he experienced, mechanical changes, obviously, but also emotional changes, and more, either on his own or if he had an assistant being present with him. But he wanted to make sure. So he didn't present his new theory and practical techniques for over 30 years until he was satisfied that it really worked and in a wide variety of situations. Fortunately, today, we do not have to take such wild and extreme actions for ourselves. So how did it develop? Dr. Sutherland's experiments could have had really wild side effects, and they did. Awful headaches. You can imagine if you squish your head and expect it to work okay, it wasn't likely to. Earache, psychotic events, confusion, altered gait patterns, and pain in other areas of his body, a racing heart, shortness of breath, and more. But all of this showed that by changing how the mechanics of the mobile skull worked and fully understanding how the intricate mechanisms worked as well, it alluded to the many applications and difficulties his patients could be helped with using this much more subtle approach. Like many scientists of his time, he couldn't do double-blind trials. In fact, we still can't do double-blind trials in osteopathy because the treatment is always individualized. Each touch is by necessity different. Now he also realized that he could affect changes in other areas of the body too, using similar, gentle, subtle techniques, and that he could also work on any tissue or organ in extraordinary detail. For example, a heart valve, ovaries, lung tissue, during pregnancy and afterwards, and also helping babies with things like not sleeping, regurgitating food, restlessness, and a load more. So how did things progress? Well, he was the first person to feel a rhythmic shape change in the bones of the skull. Let me say that again, because it blows away many myths, which are still current among many doctors today. There is a rhythmical shape change to the skull in life, which is palpable by skilled practitioners. It's subtle. You're not going to see it. It is difficult to measure, but it is nonetheless there. And he later called this primary respiration. Unlike our normal breathing mechanism of respiration, which he found was secondary to this primary. So this means that primary respiration activity activated the sequence of events for secondary respiration, what we think of as breathing, to be carried out. Extraordinary, isn't it? His model of an involuntary mechanism which runs the life and motion cycle underlying the health remains valid today. He never claimed to create a new concept, simply saying that the principles of osteopathy also applied to the head. And in his later years, he was joined in his studies by other osteopaths who developed and further explored this model. And he died in 1954, which is 70 years ago now. So how can it treat so many things? Cranial osteopaths use a highly trained sense of touch. We are able to feel subtle changes in tension and tissue quality in the living anatomy of the whole body, and to diagnose areas of strain and dysfunction. The osteopath is often drawn to areas in the body that have been affected by past events, such as old accidents or injuries. The body may have learned to compensate for a traumatic event or injury, and the patient may be completely unaware that there is anything wrong in that area any longer. But the effects may still be present and relevant to current symptoms. The diagnosis and treatment are intimately linked, as the osteopath works to activate the innate ability of the body to heal itself. And by offering gentle and specific support where it's needed to bring tissues into a state of balance and release, and to restore it to health. Using this approach, the osteopath learns to listen to and be guided by the body's inner knowledge of what is wrong. That may be different to the patient's opinion and even the osteopath's opinion. This helps the osteopath to understand and treat the cause of the symptoms to reduce the chance of symptoms returning in the future. I'm often told, but it doesn't look like you're doing anything. Sometimes I don't think you are doing anything. Observing cranial treatment can be compared to watching somebody read a book. From the outside, nothing much appears to be happening. But if you are the one reading the book, you're transported into a rich world of structure, colour, depth, and emotion. And as you continue to read, the story unfolds about what's happened. In a cranial treatment, an osteopath is deeply connected to the inner world of living anatomy and physiology. By listening carefully to the body, we can tell the story of what has happened to it, what trauma, physical or emotional, it has suffered, and how it's trying to cope with the legacy of those traumas. Or even if there's an infective agent at the moment, and how it's dealing with that. In treatment, the osteopath is guided by the tissues and support the rebalancing or release of areas of dysfunction. The body has an amazing ability to heal itself and maintain its own physiology in a state of health, and uses the rebalancing during the osteopathic treatment to re-establish a healthy physiology. So, what sorts of patients or conditions can be helped with cranial osteopathy? The approach of osteopathy is a way of viewing the body rather than a type of technique, and it can be used on every patient. And we treat people, not conditions. Cranial osteopathy is widely known for the treatment of babies, but it's equally effective for children, adults, and the elderly. In an osteopathic treatment, the whole body is involved, and improvements are often noted in different areas and different systems, rather than just a symptomatic one. What does it feel like? Cranial osteopathic treatment is very gentle and usually relaxing. During the treatment, some people are aware of different sensations, such as mild tension, aching, or a sensitivity that gradually disappears, or feelings of warmth and relaxation as the blood supply and circulation changes. Other people are totally unaware of anything happening at all during the treatment, but are aware that they feel very different afterwards. Most people become deeply relaxed during treatment, and it's not uncommon for them to fall asleep for a short while the treatment's undergoing, or enter a pleasant, altered state of relaxation. I often liken it to your body communing with its higher self, and it removes the input from your busy brain to do so. Does it have a scientific basis? Absolutely, yes. With every advance in scientific understanding of physiology, in particular the physiology of the fascia, fluids, and electromagnetics in the body, we are gradually validating the theory and palpatory experiences of cranial osteopaths. There are also a number of clinical studies investigating the effects of cranial osteopathic treatment. So how do I use cranial osteopathy with a patient? I'm going to have a quick supporter because I can feel I'm drying. Okay. I sometimes use this approach exclusively for clients, especially if they're a baby or a senior or someone who's had a lot of trauma. At other times, I combine it with more traditional osteopathic approach with manipulation and massage and moving the body about. Each have their own value, but for instance, the very brief click of a joint manipulation to realign a joint makes more time sense to me and effort sense than spending 10 or 20 minutes to allow the joint to rebalance itself if I use a cranial technique. It means that I have more time during the treatment to attend to other areas that are dysfunctioning and want to have some more work for themselves. So there are quite a few myths about cranial osteopathy, like most other subjects in life. So the first one we've kind of already covered. Cranial osteopathy got its name because it includes the head as well as the rest of the body, but it's actually not a particularly good name for this approach for the osteopathy. Is it just for babies? Sometimes I'm asked that. People have heard about cranial osteopathy for helping babies, but not for other things. When thinking of the cranial approach in osteopathy, many people think that because babies' skeletons are massively softer and actually often even absent because they're not adults, that using gentler techniques is more important. Actually, babies are surprisingly tough. They have to be. They have to survive being born. But they are really, if you view them as little fluid-filled bags, working with a much more fluid, gentle type treatment suits them much more because that's the world that they are particularly living in. However, it is equally effective at treating all members of the family. And often osteopaths who begin treating babies in a family are then asked to treat older children, then the parents, the grandparents, and even the great-grandparents. And the loveliest thing about that is that I can feel the genealogy working down the generations when I have that opportunity. It's a real privilege to be a trusted healthcare professional to so many generations in one family. Because it's such a gentle approach, those who haven't experienced the efficacy can find it hard to believe that it works for adults as well as babies. The principles of cranial osteopathy apply to anyone, regardless of their age. We use our finely honed skills to palpate the involuntary mechanism and the involuntary motion or tissue motion in the whole body at a remarkably subtle level. Cranial osteopaths often refer to this quiet palpation as listening. It's funny how we have to use our senses as a description, because really we're feeling. By offering the body this listening support, it can reveal past traumas and injury, and at a profound level, I can help escort it back to health. We do this by supporting a rebalancing or release of whatever the area of dysfunction may be, and the self-healing mechanism in the body pretty much does the rest. This approach is as effective after decades of injury and coping mechanisms as it is in the very young, where often many people think, but they're a baby, they have nothing wrong with them. It's not always true. Some people do not think that it's effective for back pain, but I can tell you that that is really not true. The Southern Cranial Society recently completed a research data collection study comparing the treatment outcomes of cranial osteopaths compared to the rest of the osteopathic profession. And the study demonstrated that those trained in cranial osteopathy had the same rate of response to the rest of the profession, but over, interestingly, a wider range of age groups and conditions. The study showed that patients received on average 3.1 treatments from an SSCO trained osteopath for each episode of care, compared with an average of 3.4 treatments for the general osteopathic profession. Patients reported an average of 64% improvement in symptoms as well. And that clearly demonstrates that cranial osteopathy is effective for all conditions for which patients consult osteopaths for. Science and osteopathy, and cranial osteopathy in particular. When a new drug is developed, researchers usually start with the molecular structure, finding out how the chemical substances all work before developing a drug to trial on patients. Osteopathic research, in common with many other modalities, must work the other way round, with treatments that are already being practiced, being analysed for the consistent component parts that make the treatment effective. Excitingly for us, recent discoveries made during research in the fields of cell motility, movement, fluid dynamics, and the properties and function of fascia have helped osteopaths to better understand the complex changes that they can feel going on under their fingertips during a treatment. Now I want to just talk a little bit about a few areas that I treat quite a lot and that cranial osteopathy is particularly useful for. The first one is cranial and pregnancy. Clearly, pregnancy is a life-transforming experience for both parents, heralding the birth of a new being. Although it's a natural process and part of the normal life cycle, each pregnancy is a special experience. There are a myriad of physical, chemical, hormonal, and emotional changes taking place. Cranial can also be a useful adjunct to help parents become pregnant to start with, along with the osteopath's knowledge of nutrition, lifestyle habits, and change which may also help during the pregnancy. As the baby grows inside the uterus, the mother's body has to make space, and her posture has to adapt as a result. Each woman responds differently, depending on her previous history, perhaps. Past pregnancies and accidents may affect the mechanical workings of the spine and pelvis, whilst illness may have a bearing on the tissue state of the body. These factors, plus the natural loosening of the ligaments in preparation for the birth, may lead to aches, pains, fatigue, hormonal changes, and more. Osteopathy can be used to relieve these. And as the birth approaches, with reducing space to move around in, The baby needs to also be in the optimum position for delivery. Any past trauma to the pelvis, sacrum, or coccyx may distort the birth canal, potentially affecting the baby's descent. Osteopathic treatment is safe and non-invasive method of treatment, and it may help relieve the stresses and strains on your body during pregnancy or after birth. Excuse me. Osteopaths also offer advice and exercise therapy to support you during pregnancy. And some osteopaths work with the local midwives and health visitors to help pregnant women and new mums. It's a really pivotal time of life for many women, and obviously essential for babies. So osteopathic treatment aims to help the new mother's posture to return to normal after delivery. And some osteopaths work alongside lactation consultants to give postural advice relating to breastfeeding, and also help the baby and their musculature operate correctly so that breastfeeding can take place properly and not end up with indigestion, regurgitation, restlessness, pulling back, etc. So we've obviously covered a few things in this so far, but during, as I said earlier, babies are particularly well known for being treated with cranial osteopathy. Obviously, it's a gentle treatment, and so it's suitable for babies. And it often helps soothe and relax your baby. Feeding issues, persistent crying or posseting after feeds, head torsion and odd shapes, or restless babies, babies that are failing to thrive, hearing issues, very active or underactive or unresponsive babies can all be treated. And also those who have altered development from in utero causes, and also genetic, for instance, Down syndrome or cerebral palsy. And yes, of course, we also treat babies as they turn into children as well. They are absolutely perfect for treatment during all stages of their development. And the embryology and the development of the child is an area that we study a lot as osteopaths, and particularly as cranial osteopaths. The philosophy of osteopathy is to treat the person rather than the condition. And whatever the age of the patient, osteopaths aim to work with the body's self-healing potential, supporting the forces that are already at work within the body. Meeting developmental milestones, for example, growth milestones or emotional development, mental development, such as reasoning and understanding, or specific language issues, dyslexia, for example, can all be helped by knowing the neuroanatomy, helping the physiology, and allowing those forces to develop to the best of their ability. It gives each child the best potential that is possible. Injuries to the head, falls, I mean, goodness me, whose children don't fall over on a regular basis, or sporting collisions, damage to muscles, twisted ankles, asthma, and anxiety, behavioral issues, for instance, aggression or an inability to express oneself, leading to frustration, recurrent ear infections, sinus infections, migraines and headaches, issues with teeth and dental function, wisdom tooth eruption. All of these can be helped. Asthma and hay fever can also be helped a lot. And some causes may go back to birth trauma as well, because of the pressure on the respiratory centres right in the back of the head. Plus, learning to manage stress and pressure at school. Often the adaptation is for the body to lock up, and that leads to other problems. Hormonal changes can be helped. And goodness me, don't our teenagers need that support? They can be helped either directly or indirectly using Cranial for both boys and girls. Family social mechanics and function can also help alter how the physical body responds to life. And often I can make an impact there too. Plus, I have my neuro-linguistic programming training, NLP, and also as another interface to be able to bring to the conversation to help that individual develop themselves and leave behind negative emotions and limiting beliefs. So let's talk about back pain. Most osteopaths, funnily enough, are very used to treating back pain. It is, or used to be said, the bread and butter of being an osteopath. That's fine. The research has shown that 80% of people experience back pain at some time in their life. Most episodes of low back pain settle after a couple of weeks, but up to 85% of people may have recurrent courses with further acute episodes, and that's just miserable. Back pain can have a significant impact on the quality of your life and is a major cause of time off work as well. And research also shows that chronic pain is often associated with depression, anxiety, and poor sleep, leading to fatigue and exhaustion. So why does back pain begin? A really common story from patients is that one day a simple movement such as bending down to pick something up caused a sudden acute spasm in the back. Why would this happen in an apparently healthy individual though? Osteopaths consider and examine the whole body of the patient. This includes cranial osteopaths. During an osteopathic examination, it's really common to find several different and apparently unrelated areas of strain or tension in the body. Individually, each of these may well be easily tolerated and the patient may be completely unaware of any problem. But with a combined effect, all of these mechanical challenges may reduce the body's ability to tolerate additional stresses and strains. For example, in a hypothetical case, someone has poor posture, such as slouched shoulders, and this will impose an uncomfortable pull on the muscles and ligaments of the neck. This will be made worse if the patient also has general poor muscle tone, especially in the abdominal and back muscles. Tripping or falling onto one knee may cause a twist through the joints of the pelvis and resultant tension in the low back too. Emotional stress can produce tension in the diaphragm and restrict the patient's ability to take a deep breath and be fully oxygenated. Now, if all of these exist in one patient, the simple act of bending over to pick something up might just overload the whole system and cause a muscle spasm or a strain, and that will give you sudden acute pain. So osteopaths have two aims during their diagnosis and treatment. The first is to identify and treat the cause of the problem, the pain, muscle injury, joint strain, intervertebral disc damage, whatever it might be. And to understand why this back has been vulnerable to that strain and to improve overall spinal mechanics so that it is less likely to occur in the future. So what does osteopathic treatment involve? We use our hands to examine the patient for areas of tension in their muscles and ligaments and areas of spinal stiffness or joint instability. They use a variety of gentle techniques to release areas of tension or stiffness. We work to restore balance and flexibility to the whole musculoskeletal system. During treatment, the cranial approach to osteopathy can blend seamlessly with other osteopathic approaches to achieve the desired effect, or can be used on its own. Osteopaths are trained to assess the way in which a strain acquired from an injury distorts the symmetry and balance of movement through the joints and tissues of the body. And we'll bring a little prop. This is a tensegrity ball, and it's very good at illustrating how cranial osteopathy in particular works. So in this posture or position, all the nodes on the ball are at the same tension, and it has this shape. But if I change the structure by pulling it out, the nodes on the ball still have the same tension. They're in reciprocal tension. Squeeze it, you can see they're all in the same tension at the same time. But the function of the ball is quite different. So now you have more of a round football versus a spiky ball. So an osteopath, and particularly a cranial osteopath, looks at changing the structure and function with their hands and with the knowledge that they have in order to effect a structural change or change in function. Now, we're also trained to know when we should refer our patients with back pain or any other symptom to their medical practitioner or GP. We might need to ask for further tests, a CAT scan or an MRI or an X-ray, for example, for instance, if there's an intervertebral disc damage, or we suspect there's more serious pathology. The interesting thing is that we take into consideration the three-dimensional effect of anatomy and try to understand how different systems in the body are interrelated and correlated. For example, if the muscles of the chest are very tight and tense, it may be more difficult to take a deep breath, which restricts the lung capacity and its function. And if you're more stressed, you need more air because you become then more anxious. And so it becomes a negative cycle. Osteopaths are very good at changing that situation and restoring better health. And then the last thing I really just wanted to touch on today, and it's been, I understand, a whistle-stop tour, but I hope that it's given you some idea of some of the things that we can help, is treating whiplash injuries. Now, these come about as a result of the forces of a sudden and unexpected, often, stop or change in direction of the body. Most commonly, and usually most severely, unfortunately, from a car accident or a fall. Younger bodies can usually recover better as the tissues are better adapting and are more pliant. The anticipation of a bang can aggravate because of the bracing effect, and the forces are usually greater as a result. Now, the problem arises from the abrupt stop and torsion which the tissues are subjected to. Tendons classically provide the end of range of movement. So, for instance, my knuckle won't bend any further back because the tendons down the front here and the ligaments in the joints are preventing it from doing so. With accidents, though, the end of range of movement is passively exceeded with large speed changes as well. And the body is simply not designed to adapt that quickly and safely to avoid direct tissue damage. So that might be torn muscles, torn ligaments, dislocations, you name it, as well as fractures and soft tissue damage as well. Basically, it means there's going to be some tissue tearing. This can lead to microbleeds in the muscles, organs, brain itself, and within the joint capsules too. This leads to internal and sometimes visible bruising over and above any direct area of contact as a contusion, which you would expect. But in addition, the energetic inertia in the body means that while some areas have stopped, this area here, if that's the block, but the rest of the body is still moving, at least up to a point. That's the inertia. So you have a blockage and a crumple zone, for example, over a steering wheel. But the head and neck particularly are able to travel and continue to recoil. But the energetic body, which isn't an anatomical structure, continues to move. In fact, it can continue, so the end point can be well outside the body altogether, depending on the forces or the speed involved. The distance is related, obviously, to the forces and gets complicated by additional torsions that may occur. For example, if the car spins round as it comes to rest or somersaults over, or combinations. As a result of the energetic body being shifted, the emotional and mental body has to adjust too. And this leads to other symptoms. For example, confusion, shock, cloudy thinking, emotional dysregulation, so that you react abnormally to stimuli that really you should just ignore. Ups and downs in energy levels, a sense of deja vu, or as though you're living in outer space, literally. And if you think about it, if your body is now trying to orientate itself around a center point that is outside of the physical body, you are going to feel a little bit weird, aren't you? Because you can't get that center point around which this body is operating back into your body without help. And that energetic body is, if you like, the midpoint that everything operates around. Now, this is not to say that whiplash injuries are easy or quick to treat by whatever process and therapy you try. But you can literally feel as though you are coming home as you start to, as you start to normalize the sensations and get the function back into their own center points and back to health. Now, regrettably, the medical profession is far behind in its understanding and research about this particular area, which is tragic. And it means that they often say you just have to put up with it and it'll go over time. They have no solutions apart from have some more painkillers or have some whatever. They're treating the symptom. They're not treating the cause and the reason why those symptoms are existing. It doesn't make a lot of sense because it doesn't make it different. It just puts a sticky plaster on it. So whiplash injuries are an experiential experience. So one that is hard to measure, but nonetheless true. Fortunately, this can be helped even long after the accident or incident, although the results may be less effective because the body will have tried to adapt and heal over time to accommodate to its new normal. Many insurance companies, fortunately though, will pay for osteopathic treatment post-trauma, and it is really worthwhile asking if that is available for you. So I hope that that has given you a little bit of an idea about cranial osteopathy, what it is, how it came about, and just some of the things that we can treat as a cranial osteopath. If you have got any questions, you're very welcome to post them to me. And if you're interested further, I write lots of blogs, etc. And you can find that information on www.livingelements.co.uk. My name is Gayle Palmer. I am the registered osteopath at the Living Elements Clinic. Thank you so much for joining me, and I wish you good health. Place your healing in my hands. Trust your osteopath. Thank you. Bye-bye.